What's the difference between a panniculectomy and an abdominoplasty? So a panniculectomy is a reconstructive procedure where the extra skin and fat below the belly button is amputated and thrown away. So panniculectomy is reserved for patients who have a debilitating pannus. Pannus that has lymphedema, a pannus that makes it hard to walk and move around, a pannus that makes it hard to keep clean, it develops rashes. All those functional problems can make someone a candidate for panniculectomy, which is a reconstructive procedure that's designed to just cut away that extra skin and fat and sew you up. There's nothing fancy about it, there's nothing pretty about it. It's just a functional operation to get rid of extra hanging skin and fat. Your belly button will probably get thrown away and you'll have no belly button, and your muscles will not be tighter. And the whole goal is to get rid of that extra skin and fat without having any wound healing problems. In other words, minimizing the risk as much as we can that you have a problem healing that incision. That is a panniculectomy, nothing more. An abdominoplasty is different. An abdominoplasty is a cosmetic operation that's designed to make the abdomen look as good as possible, to make the abdomen as attractive as I can make it. And that involves getting rid of the extra skin and fat of the entire abdomen, from the breasts all the way down to the groin. That is our goal, is to basically make the abdomen as flat and tight and thin as we can. It also involves tightening the muscle layer, which helps us get the abdomen as flat and tight and thin as we can. And finally, we put the incision as low as we can so that it can be hidden underneath bikinis, lingerie, garments that women want to wear with their new flat, tight abdomen. So that's the difference between a panniculectomy and abdominoplasty. The panniculectomy is very functional, and we do not worry about how it looks. We just want the hanging pannus gone, and we want the patient to heal. An abdominoplasty takes things to a totally different level, where we use liposuction, we tighten the muscle, we put the scar really low. In other words, it's reserved for people who are usually healthier and can tolerate a lot more manipulation and surgery to their abdominal wall. Panniculectomies are often covered by your insurance plan. Abdominoplasties are never covered by your insurance plan because it's not considered medically necessary. And if I were to perform an abdominoplasty, I should say, and bill your insurance company for a panniculectomy, I would be committing insurance fraud. So we cannot do that. So please do not come in and ask us to do a cosmetic abdominoplasty for you and bill your insurance company as a panniculectomy, because you are putting us in a very awkward position where we would be committing insurance fraud. So we will not do that. And if we're going to perform an abdominoplasty, after we're done, we will not bill your insurance company for a panniculectomy. That happens as well. People will come in for abdominoplasty, they'll pay cash for an abdominoplasty because they're never covered by insurance plans. And then after we're done, they'll ask us to bill the insurance company for a panniculectomy. And obviously we can't do that because we didn't perform a panniculectomy, we performed an abdominoplasty, and that would be insurance fraud. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.